Alright, hi guys, I'm Dr. Siraj Ahmad, your faculty of pharmacology, and as you can see on the screen, the topic that I'm going to discuss, that is one of the very important topic, and questions from general pharma is definitely asked from this topic, right? So the topic is TDM, that is therapeutic drug monitoring. Before I can discuss with all of you guys this topic, let me integrate this topic clinically and show you one very simple question. In which of the following drugs therapeutic drug monitoring is recommended? You can pause the video and you can give your answer, and then you can listen to the explanation sometimes later. Okay, I mean after some time, after you have already answered. So option A is saying antihypertensive drug in pregnancy. Option B, a patient on ACT, that is artemisinin combination therapy with cerebral malaria. Congestive heart failure on ACE inhibitors, right? Congestive heart failure patient on ACE inhibitor. Depressed patient on TCA. TCA is tricyclic antidepressant. So I given you the answer already. I hope you have already got your answer. If you have got, let's quickly see the therapeutic drug monitoring ka important aspect. Two important things that examiner is always asked: TDM, that is therapeutic drug monitoring. Currently, they are more asking where is it not done compared to earlier when they asked where is it done. So first and foremost, therapeutic drug monitoring is done in, and the second one is not done in. Always and always remember, guys, therapeutic drug monitoring is done whenever there is any narrow therapeutic index. If there is any narrow therapeutic index, in that case scenario, therapeutic drug monitoring is done, right? And previously, in previous videos, we have already discussed what is the formula for therapeutic index. The mnemonic is trial, right? Therapeutic index is equal to lethal dose in 50% divided by effective dose in 50% of the responder, right? TILE is the mnemonic, TILE. Therapeutic index is equal to lethal dose divided by the effective dose in a 50% of the experimental population. However, therapeutic drug monitoring is also done if effect cannot be measured via any other investigation. Can't be measured via other investigation. If I tell you where is it done, then you can tell me, sir, it is done. Sorry, where is it not done? Right? Cut kar dijiye, cut. If I tell you where is it not done, then the second one that we are having, where is it not done? It is not done if there is a wide therapeutic index. Wide therapeutic index. So wider therapeutic index, that means the lethal dose and the effective dose ka jo margin hai, it's pretty wide, and they're very safe kind of drug. In that case scenario, we don't need to do therapeutic drug monitoring. Example, let's say penicillin is a drug that is having wide therapeutic index. Other antibiotics, they are also having wide therapeutic index. Fluoroquinolones can be wide therapeutic index, right? Okay, where is it not done? If effect can be measured, via other investigation. If you can measure the effect via any other investigation, you don't need therapeutic drug monitoring. A pretty simple example that I can give to all of you guys. Let us say there is a patient who is on, your patient is on oral hypoglycemic agent. Let's say he's taking metformin for diabetes mellitus. Should you do therapeutic drug monitoring? What is therapeutic drug monitoring? Monitoring the plasma concentration level of the drug. Monitoring the plasma concentration level of the drug so that you can do the dose titration. So in a simple definition, if the examiner is asking you, write short note on therapeutic drug monitoring or discuss briefly therapeutic drug monitoring. So first you give the definition of therapeutic drug monitoring is dose adjustment according to plasma concentration. And what you are going to measure in the plasma is the concentration of that drug. And now in every drug, you're not going to do this concentration measurement. They're pretty expensive kind of test, right? So what you are going to do, you are going to see if you can measure the effect by any other investigation. Like there is a patient on oral hypoglycemic agent, let's say he's taking sulfonylurea or metformin. You don't need to check the concentration of metformin in his plasma. No, you don't require. So what you need to do, simply do HbA1c monitoring, right? There is a patient on, let's say, ACE inhibitor, right? He's on ACE inhibitor for his hypertension. So you don't need to check level of ACE inhibitor in his plasma. Then what you need to do? All you need to do, simply do serial BP monitoring. Okay, agreed. Then what else that we can do? What else? Let's say there is a patient on warfarin. There is a patient on warfarin. He is taking warfarin for his anticoagulation effect. So you don't need to check the concentration level of warfarin. You don't need to check level of warfarin in his plasma. What you need to do? You can simply do PT-INRC. How simple is it? Kahan pe nahi karenge, that is more important. Wherever you can measure the effect. Just imagine, okay, your patient is coming, he is on antibiotic. Antibiotics are usually having wider therapeutic index, except few that I'll give you the exception, I'll give you the list. Or wherever you can measure the effect via any other investigation. There is a patient who is coming to you and he is on immunosuppressant, right? How can you measure how much of the immune has been suppressed? You cannot measure. You do not have any way to measure the immune. So then in that case scenario, you need to do the plasma concentration level of the drug. So let me give you a very simple a mnemonic where you can utilize this one. Example of a drug where TDM is required, and the example that I give you is Pyara Dalit, a all-time favorite mnemonic है students का, and from ages students have been using this and they have been taking advantage of this mnemonic. Pyara Dalit, P Dalit, that is stand for your P Dalit. This is stand for your phenytoin. Is an anti-epileptic drug. It's one of the drug that is among anti-epileptic drugs. So can you do therapeutic drug monitoring of other anti-epileptic drug? Yes. But if I measure phenytoin ka range is much lesser, right? How much is it? That is going to be 10 to 20. This is the therapeutic plasma concentration. 10 to 20 microgram per ml is the therapeutic plasma concentration. Beyond that, they start following zero order, though, so we need to do therapeutic drug monitoring. If I ask you about carbamazepine, so that is going to be 4 to 8. If I ask you about valproate, how much is it? 50 to 100. Although 50 to 100 बहुत ज़्यादा wide नहीं है, but compared to phenytoin, it is little wider. So with the phenytoin, definitely we need therapeutic drug monitoring. D stand for your digoxin. A stand for your aminoglycoside. Example of a drug like, let's say, streptomycin, capreomycin, kanamycin, they are the example of aminoglycoside. L for your lithium. I for your immunosuppressant. For example, cyclosporine is one of the immunosuppressant. Tacrolimus is one of the other immunosuppressant. Cyclosporine, tacrolimus, they are the example of a drug under immunosuppressant. And T for your theophylline. और एक और टी आ जाएगा, टी फॉर योर TCA, that is tricyclic antidepressant. TCA, tricyclic antidepressant, imipramine, trimipramine, clomipramine, and these are all the drugs coming under the tricyclic antidepressant. So what is more important here compared to where is it done, comparatively they are asking where is it not done, and these are the example, है ना. अगर आप देखिए पेशेंट का ऐसा ड्रग चल रहा है which you can measure by any other investigation, therapeutic drug monitoring is not done, and earlier the question was very favorite, that is where is it done. So P Dalit is a very simple mnemonic to remember all the area where TD, therapeutic drug monitoring, is done. Now let's see the question once again. That there is a patient of anti-hypertensive drug in pregnancy. So just by looking at the pregnancy, many people will think, okay, this is a pregnancy scenario, this can be a serious scenario, we need to do. No, you don't need to do therapeutic drug monitoring. Anti-hypertensive hai, BP monitoring kar lo. Patient on artemisinin combination therapy for cerebral malaria. Artemisinin is a drug that is having wide therapeutic index, hai na? So again, remember, symptomatically also you can judge your patient here. And congestive heart failure patient on ACE inhibitor. Just by looking at the heart failure, again, many people will think, acha, heart failure hai, कुछ तो गड़बड़ है दया, है ना. कुछ भी गड़बड़ नहीं है दया. कंजेस्टिव हार्ट फेलियर है, ACE inhibitor ले रहे हैं. Again you can see ACE inhibitor have wide therapeutic index. You can measure the effect via symptomatically also, or if you want to see some congestion, you can do multiple other investigation. I mean, let's say radiological से आप देख सकते हैं, symptomatically भी आप patient को देख सकते हैं. But depressed patient on TCA, tricyclic antidepressant, remember प्यारा दलित में T for TCA था, so depressed patient on TCA, or this option could be patient on immunosuppressant, वहां पे भी आपको therapeutic drug monitoring could be required. So this was a very quick review of wherever you need therapeutic drug monitoring or where you do not need therapeutic drug monitoring. I'll see you in the next video. Thank you very much.